call to order the July 24th, 2018 meeting of the Saline County Board of Commissioners. I ask that you please silence your cell phones if you haven't already done so. Will the clerk please call the roll?
Commissioner Shadwick?
Here.
Commissioner Sparks?
Here.
Commissioner Vidrickson?
Here.
Commissioner Weiss?
Here.
Commissioner White?
Here.
I ask that you please stand and join me in a flag salute followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We'll now move to the public forum where citizens may speak on county government, usually limited to 3 minutes, and items that are not on today's agenda.
Norman Mantle, Salina, Kansas. A week ago I was at Kansas Water Office meeting, regional. Never seen anybody from the commissioners there attending that meeting. You need to attend some of these official government meetings because it concerns us about water, folks. Why wasn't anybody there? Somebody should have been. This state, this country is in a serious drought. And you need to see what's going to happen. So I would ask you, you need to attend more official government meetings. That's your responsibility as members of this commission. You represent the county. Why aren't you there?
Thank you. Does anyone else wish to speak? Hearing none, seeing none, I will bring it back to the commission for regular business. Item number 1.
Approve agenda for public forum as presented.
Mr. Chairman, I move we approve the agenda for the public forum as presented.
Second the motion.
Been moved and seconded that we approve today's agenda. All those in favor say aye.
Aye.
Aye. Opposed, same sign. Motion carries. Item number 2.
Approval of county commission minutes for July 10th, 2018.
Mr. Chairman, I move we accept the county commission minutes of July 10th, 2018 as presented.
Second the motion.
Been moved and seconded that we accept the county commission minutes of July the 10th, 2018. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Item number 3.
Approval of county commission minutes for July 17th, 2018.
Mr. Chairman, I move we accept the county commission minutes of July 17th, 2018 as presented.
Second the motion.
Been moved and seconded that we accept the county commission minutes of July 17th, 2018 as presented. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. We are now into item number 4.
Idle fund report with Jim Du Bois, County Treasurer.
Good morning, Jim.
Good morning, Commissioners. Once again, it gives me great pleasure to give you good news. Good news is always a good thing. For the second quarter idle fund report, if you look at your sheets and go 3/4 of the way down, there'll be a line there that says interest earned as of June 30th, 2018.
Jim, I think they said that your microphone is off. I'm sorry to interrupt you.
Okay. Testing.
They got it.
Okay, sorry about that. If you look at the interest report, and it says June 30th, 2018, I want you to go down one more line there where it says 2018 year-to-date interest reports, and I already gave you the reports from the first quarter interest at $110,531.17. Second quarter, we did a little bit better, $140,533. Interest rates still are looking good. You know, the bond rates are still at 1.45 and 1.80. So that's good for us in there. We earned $140,533 this quarter. Last year, compared to that, we had $39,521 for a difference of $101,011. So our second quarter earnings, including the first quarter, brings us to $251,064 at this particular. I always hate to estimate, but if things continue to go well and things do look good for now, we'll hopefully hit that $500,000 mark. And we haven't hit that $500,000 mark in over 10 years, so which would make me pretty happy. I'm sure it'd make you guys happy too. So with that, I'll be open for questions.
All right, are the questions of Mr. Du Bois from anyone?
None.
Public comment? Seeing none, Thank you for the report and the good news.
Looks
and,
good. Yep.
We appreciate it.
Good
You bet.
job.
Have a good day, everybody. Thank
All
you.
right, thank you. Item number 5.
RFA 172-18, Amendment 13 to Resolution 878, Uniform Road Naming and Property Numbering System with David Neal, Planning and Zoning Director.
Morning, David.
Morning, Commissioners.
Good morning.
This is something we had talked about a few weeks ago. The current addressing policy, when several houses share a single driveway, basically, we address them off of the main road, so you'll end up with, and we address them using basically an apartment letter. So you'll end up with 111 Holmes Road, 111A Holmes Road, on down the line for however many houses. And we have had a resident bring that up, and it aggravates me, it aggravates the 911 services, the mail, the UPS carrier, everybody, because the addressing, you end up with the same number, so if you don't know who lives where, it's hard to find the right house. So we've been asked to fix this up, and I have no problem with it. The proposal is to allow the county commission to name these driveways as private drives. Basically, you'd be giving it a street name, but it stays as a private drive. It's maintained by the property owners. The county would take no ownership of it, no responsibility over it. We just provide a name and let all the houses get addressed off of that new street name. To do this, the residents would have to provide me a petition signed by, I would like to see everybody sign it, but we're setting at least 75% of the property owners need to sign that petition before we bring it to the county commission. Once we have that, we'll also need to have some recommended road names. Just give me something that's unique so that you don't have a repeated road name in the county, and you want to do it instead of me because you'll end up with something funny if I do it. Once we have some road names, we'll bring this to the county commission for public testimony. So you'll hear from all the neighbors what everybody thinks, good or bad, because not everybody wants to have an address change. This happens sometimes. Once you have everything, it's up to the county commission whether or not to name that road. And then once you name that road, every address along that road will get an address change. Once that's done, the property owners, if they would like a street sign, they have to put up their own street sign, and they'll continue to maintain the road. And that's the way we have the new policy written. Any questions over that?
Well, my question would be, first of all, you say they would all be subject to the name change. If you have a person, and I'll just use your example here of Holmes Road, 111 Holmes Road, if that person is sitting right out on Holmes Road, is he going to have his address changed to?
If his driveway is on the new road, it would be addressed to the new road. If your driveway is on Holmes Road, we'll address you to Holmes Road.
Okay, that's clarified. How many roads or situations are we talking about here?
Top of my head, I want to say there's about 4 neighborhoods that do this. There's 2 in the area of Holmes and Schilling. There's one about 9th and Shipton. 1, 2, 3. Trying to remember. I know I've got another one out there. And I want to say it's down east side of Country Club somewhere.
Okay. Are there like 2 or 3 in these things, or are there multiple, several?
Typically, it's about 3. I have one that goes up to letter G. So some of them have a few more.
Okay.
And it's up to the residents. We're not going to change anything unless you petition us to change something. So if it's working for you, we'll keep it the way it is.
Well, and that would kind of be my question. We don't have any, there's nobody here from any of those housing districts that are saying anything one way or the other, so.
Not that I recognize now.
So questions of staff?
Yeah, I'm sorry, Mr. Chair. Is there a way to protest it? Like if there's 5 of them and one says no? I mean, is it just, did we
Once
decide?
the county commission has made a choice,
Yeah.
you'll have a public hearing.
Right.
So they can say their piece in front of the county commission.
Okay, that's,
But once the county commission says yes or no,
right.
it's your choice.
Okay.
Go ahead, Joe, I'm sorry.
Is this kind of a house cleaning type thing? I mean, policy today doesn't allow for this type of thing, does it?
Right. The policy today, we would not have a shared driveway like this.
So this is just kind of cleaning up prior
Hopefully
activities.
making life better.
Right, okay.
So if they don't have 75%, are they still allowed to bring it to the commission?
The way our policy is set is that we won't bring it without 75% of property owners signing.
So in other words, if one guy out of 5 wants to do it and the other 4 haven't signed it, there's no sense in changing it.
Right. I mean, there is always, because this is more policy than regulation, the county commission can set their agenda however they like. If you want to rename Holmes Road, you can do that tomorrow, and it's done. Just realize the cost to everybody that you'll end up getting.
The resolution here is to, for the uniform road naming and property numbering system to change.
Right.
So you want us to vote on that today? Is that what I'm?
Yes.
And I'm kind of uncomfortable doing that without any input from the public.
Well, we can. I have no problem passing it off. It's not like it has to be passed today.
Okay, go ahead, Roger.
Okay, well, I just want to say, Mr. Chair, is that one of the things also is that I think that this is the horse leading the cart. I think we have to pass this here before some certain things are going to be done, and that is like sending out the letter to these people, letting them know that, hey, we are looking at doing this, because you have to have this before we do that.
And if you want, I can send letters out to people tomorrow and let them know. That way you get more public input, and if it makes you...
And I just look at this being as a complete safety for the people out there and the residents, because I know I live in a vicinity that there's 2 or 3 of these situations that we're out of right here, that many times over the last 10 years that an ambulance or a fire people come out there and they can't find the address. They don't know where to turn to because the GIS cannot find that address. And so to me, it's purely a safety issue coming down the road for the emergency management and ambulances and all that stuff. I mean, it's just we need to clean this up now. Yep. But that's my input. Yep.
Do you anticipate this being an administrative nightmare?
No. I figure one neighborhood might come in. We have the one resident that's mentioned it, so I figure that one will come in with a petition. After that, you might get one in another year. There aren't that many, so it won't be that big of a deal.
Okay. Thank you.
Well, personally, I'd like to put it off just a skosh, just to hear from the public, but that's just my opinion.
I understand your concern, but I don't think we're to that point. I mean, I think this is just a vehicle that allows them to come forward, that allows then that person to protest.
And
what would they protest right now?
If we pass this resolution, we're at what stage then?
We can allow them to petition.
Okay,
today,
this isn't going to be for a renaming. It's not going to say we're going to rename these roads.
No, it just allows
it allows them to have the right to petition.
And then allow that person to come forward. Right now, that person can't come forward and protest because there's nothing on the books. So
there's not a process. They can come to the commission, and the commission can take whatever action it feels is appropriate. Right. Administratively, I have nothing that I can do for them.
Right.
I'm getting a clearer view of it now that it's defined that way for me. My mind isn't working straight today.
If you pass this today, absolutely nothing will change for anybody in those neighborhoods. But they have the ability to bring me something that I can bring to you and say they'd like a road name change.
Gotcha. Okay. Is there any public comment regarding this? Seeing none, I'll bring it back to the commission for possible action.
Mr. Chair, I move we adopt amendment number 13 to resolution 878 as requested by staff.
Second the motion.
It's been moved and seconded that we approve RFA 172-18, the amendment to 13, resolution 878, uniform road naming and property numbering system. Further discussion? All those in favor say aye.
Aye.
Opposed, same sign. Motion carries.
Thank you.
All right, thank you, Mr. Neal. We'll move to item number 6.
KDHE Aid to Local Program Universal Contract Attachment Number 17 for Maternal and Child Health with Jason Tiller, Health Department Director.
Good morning, Jason.
Good morning, Commissioners. We've got a few, like 3 contracts here that we're going to look at. In addition, I've also provided you with a document that is the State Fiscal Year 2019 KDHE Aid to Local List of Grant Awards. simply because when we forwarded these contracts over, did not realize at the time that those award amounts were not listed on the contracts themselves. These are amendments to that aid to local master contract that the commission approved a couple weeks ago for these specific programs to award these grant amounts. So this first one is for the maternal child health program, contract attachment 17. If you look on that list of grant awards, the amount is $150,771 for the period of July 1st, 2018 to June 30th, 2019. And this provides for the maternal child health program to be able to provide its services, becoming a mom, home visits, and such.
Questions?
Is number 17 one grant, or is every one of the sub-items a grant?
Well, the way KDHE does it, so the master document that you approved a couple weeks ago is the overall, and then each grant award has a separate attachment like this to award that amount.
Specific to that area.
Right. So yes, it's a lot of paperwork we have to do each year.
That's a tremendous amount of grants.
Absolutely.
All right, is there any public comment? Seeing none, I'll bring it back to the commission for possible action.
Mr. Chairman, I move we sign attachment number 17 as requested by staff.
Second.
Been moved and seconded that we sign attachment number 17 as requested by staff. All those in favor say aye.
Aye.
Opposed, same sign, motion carries. Item number 7.
KDHE Aid to Local Grant Program Universal Contract Attachment Number 18 for Child Care Licensing Program.
Morning again, Jason.
Good morning again. So same thing here for this contract attachment number 18, Child Care Licensing Program, in the amount of $74,555. That's also on your grant award sheet. This program, of course, helps provide for the for the personnel to be able to perform all the regulatory inspections of child care facilities, ensuring safe child care, education, technical assistance, and the like.
Questions of Mr. Diller? Do we have one person that's specific to that area?
We have two.
Two.
Correct. And they cover 3 counties. They cover ours, McPherson, and Ottawa County.
All right. Any further questions from Jason? Any public comment? Not, I'll bring it back to the commission for possible action here.
Mr. Chairman, I move we sign attachment number 18 as requested by staff.
Second.
It's been moved and seconded that we sign attachment number 18 for KDHE Aid to Local Program Universal Contract Attachment number 18. All those in favor say aye.
Aye.
Opposed, same sign, motion carries. Item number 8.
KDHE Aid to Local Program Universal Contract Attachment Number 34 for the Immunization Action Plan.
All right, Jason, it's your show again.
So for the Immunization Action Plan, contract attachment number 34, this one is for the promotion of immunizations. This award amount is for $10,847 for July 1st, 2018 through June 30th, 2019.
Questions? Hearing none, I'll bring it back. Is there any public comment regarding? Seeing none, I'll bring it back to the commission for possible action.
Mr. Chairman, I move we sign attachment number 34 as requested by staff.
Second.
Been moved and seconded that we sign attachment number 34 as requested by staff. Further comments? Hearing none. All those in favor say aye.
Aye.
Aye. Opposed, same sign. Motion carries. We'll now move to item number 9.
Health Department Update with Jason Tiller, Health Department Director.
Okay, Jason.
All right, so I believe you have copies of the slides I had submitted. It doesn't look like we have them on the projection. So starting with the clinic, we conducted 6 STD family planning presentations to various groups, including high schools and Central Kansas Foundation inpatient groups. Participated in Kansas Wesleyan Health Fair along with Chapman High School Health Fair, which Our focus at most health fairs for the last year or so has been STI and STD prevention and education. We had the Ryan White audit with KDHE, which the Ryan White program is the HIV case management, and staff attended several trainings throughout the 6-month period. Up and coming, we have the community flu clinic that'll be on October 3rd at the county 4-H building. And this year, we have coordinated with the Saline County Sheriff's Office to also conduct a drug take-back event during that community flu clinic. So when residents come through to either get their shot during the drive-thru or they come inside, their excess and expired medications, they'll be able to drop off, and we get a bunch of that out of circulation.
Question, Mr. Chairman. Jason, two or more years ago, there was quite a spike in STDs in Saline County. What are the numbers looking like now? Do you have that data?
Not in front of me. I'd have to get that and get it back to you.
I will say that last year I took advantage of the community flu clinic, more of information for myself to see how it worked and how it went. And I might say that it was very quick and efficient process, and a quick way to get your flu shot that you don't have to be there on the specific day that maybe your clinic is not open. And it also they use training of Kansas Wesleyan nursing students, I think, to help.
Correct.
Help
Last
with the
year we
process.
did. And we also used this event, too, to practice the process. So if there was a large disease outbreak or some sort of biological attack and we had to rapidly get medications or vaccines out into the public, it would be a similar process that we would use. So we use that as an opportunity each year to practice that process.
And if I recall, I mean, the insurance are accepted along
Correct.
with Medicare. So
Medicare,
it's
Medicaid, private insurance. We also do private pay for those that either don't have insurance or insurance may not cover it for whatever reason or whatever case may be.
I don't think it took me more than 5 minutes last year to get do
Nope.
the paperwork and get my shot. So it's a quick way to do it.
And painless,
So,
for the most part.
all right. Are there any further comments from the commission? Any public comment? Seeing none, I'll bring it back to the. Or do you have some more? I assume you have some more.
I have
I'm sorry.
some more on
I'm
here
getting
still.
I'm getting ahead of myself here. I apologize.
So on child care licensing, one of the child care licensing staff is a member of KC, which is the Kansas Association for the Education of Young Children. As part of the NACI conference, was able to attend their legislation days and speak to Kansas legislators about child care licensing and the importance of early childhood education. Also, the state of Kansas will be changing their background checks for providers from just a state-level background check to a national-level background check. And for new providers, that will begin in August and then in October for all providers that are renewing their licenses. So that's better protection of children and child care across Kansas. Under health education, we continue to engage the community on Facebook, Twitter, and Instagram. Each year, we've also participated in Camp Hype with St. John's Missionary Baptist Church, which is helping youth pursue excellence. And our MPH intern had put together an education program, which we would be distributing here in the next couple of weeks on rabies prevention. So we got to talk to the kids about the signs and symptoms and what to look for in animals that might have rabies, and especially when you see those cute furry animals on the ground, don't go and try and pick them up and play with them. On the first, the health department, including many of the county staff, will be participating in the trauma-informed care and adverse childhood experience training that day. So the health department will not be open because that will be an all-day training. We have trainers coming from Wichita's Community Engagement Institute that day that will be providing that training for us and county staff. On public health emergency preparedness, we participated in both regional and local tabletop exercise on mass fatality planning and response. We attended and conducted Stop the Bleed training with the health department leadership and county department heads. And we'll also be providing a couple of sessions during the county in-service day on Stop the Bleed, which is applying tourniquets and dressings in situations, whether it be active shooter or industrial accident or vehicle accident, in order to prolong life until advanced medical care is able to arrive. Home health was named Best of the Best finalist by the Saline Journal this year. We were able to fill our vacant home health nurse position and also our home health coder position. Our previous long-term home health coder had retired. And then home health has been working on a lot of collaboration with the Saline Senior Center to provide BP checks. And they'll also be providing flu shots over at the Senior Center this fall, as well as doing community flu shot outreach throughout October in the county. WIC completed their transition to eWIC, so that now they are completely paperless. This is finalized in June. Clients now have an EBT-style card, and WIC is encouraging the use of the WIC Shopper app so that clients can be able to see what benefits they have. It makes checkout at the register a lot faster, better accountability, just overall. So over the next 6 months, we'll be continuing to monitor how that workflow is, or how that's going to impact our workflow now that we don't have as many check appointments to come in and get paper checks, because they're able just to do that through the computer system. MCH, they have participated in the 3rd annual community baby shower where they had 38 new mothers and support staff. They have kicked off the Incredible Years Parents and Babies collaboration with CAPS, which is a follow-on. So they have Becoming a Mom training, which does a lot of the prenatal education and stuff leading up to it. And then after birth, the Incredible Years Parents and Babies basically continues that education for the first 3 to 4 years of life, and our staff is teaching that first block of it right after birth, so that first 6 months of it, and then CAP staff takes the additional training from there. We also have staff that are beginning to work with the Maternal Depression Task Force through KDHE. In the future, one of the things that they're going to be focusing on is continued efforts to reduce tobacco use among pregnant mothers through a new program called SCRIPT, which is Smoking Cessation and Reduction in Pregnancy Treatment. There'll be more information coming out about that, and it's in conjunction with the tobacco tobacco control group that's here in Saline County. Advisory Council met in March and June. They also helped serve as the Family Planning Information and Education Advisory Committee, which is one of the family planning grant requirements, and Home Health Advisory Committee, which helps fulfill our requirements for that program. We discussed community health assessment, which is ongoing with the hospital and community partners, which I'll talk a little bit more here in a minute. We did an introduction to foundational public health services model, which there is a current 4-county pilot looking at the 109 measures as part of that document, and then what kind of either hurdles or challenges or successes for implementation. So we hope to have, or they hope to have that completed this fall, and then we'll be conducting assessments on that foundational public health services model, along with their input from their study for the pilot. We have one opening on the advisory council. One of the members has elected not to serve again after finishing their first term, and so we are still accepting expression of interest forms for this position until July 31st. And then in August, we'll go through those forms with commissioners and appoint somebody to fill that position. In general, community health assessment is being conducted in conjunction with Saline Regional Health Center and 18 other members of the community organizations from different community organizations. There will be a key informants meeting. It's a come and go July 27th from 11 a.m. to 1 p.m. at Saline Regional, conference room 6 and 7. And then from that time, the committee, which also includes one of our advisory council members, Amanda Michaelis, will review all the results from that. As a committee, too, we decided to look at the indicators from the last community health assessment again this year so that we could see if there was any kind of progress in those indicators. And then after that, there will be a community health improvement planning meeting of the committee to determine as a collective what kind of steps we can take from there with the data that we get from the assessment.
Jason, is the event at the hospital, is that open to the public?
Yes. Back to school fair, which has been going on here in Salina for over I think about 15 years or so, and the health department has been part of that every year. Will be taking place at Lakewood Middle School on August 3rd. And the flyer picture there is with all the information, and it's also on our website too. The rest of it is just the charts from the different program areas. I will draw your attention to the last chart, the WIC active caseload. So state and nationally, WIC caseloads had been kind of trending down for quite a while. And then here in these last few months, we've actually seen the caseload go up quite a bit. So we're not sure at this point yet if that's because people are seeing the EWIC, the EBT style card, and going, well, that's easier to use than trying to use the checks, or we really don't have a good handle yet because it's too early to tell on why we're seeing this increase. But hopefully by the end of the year, we'll have a better idea locally and state level wise as far as this trend is concerned, and be able to see from a full 12 months how EWIC possibly has affected the overall caseload, not just here, but across the state, since it is a state level implementation. And that
Remind everyone what
concludes
WIC stands for.
Women, Infants, and Children.
Thank you.
So that concludes my update.
Are there comments from the commissioners? Is there public comment?
Karen Shade, Salina. I wanted to ask Mr. Tiller, what is the status of the amendment to the animal bite procedure?
That amendment is still with the city. The three parties involved, myself, Animal Control, and Sheriff's Department, have already adopted the changes in procedure in order to better streamline that process. And that amendment was just a updating of the interlocal agreement. But the terms of the agreement haven't changed. The original interlocal agreement that covers those terms are still in effect. But procedurally, we've already updated changes.
So there's no need for signatures or anything like that?
Probably sometime in the future, but right now, no.
I don't know. It's just when, like with the agreements you're signing today for the health department, they're probably requiring signatures. Whenever there's a change, you're updating the year or whatever, there's signatures. And I spoke yesterday. The city commission clerk has not seen anything. I was told Vicki with Animal Control has written up a paragraph, and of course Jason Gage is leaving, so it's a little hard to tell, but it's concerning. I didn't have the advantage of seeing Mr. Tiller's slides, but when he said, rabies, please don't pick up cute prairie dogs, that's a little disconcerting, because the whole point of the procedure, and it was brought up through the health advisory council member who works at Stat Care, who sees people who are bit by animals, and she was concerned that if the animals are not contained, that people might have to undergo rabies treatments. So the antidote or whatever, I understand it's quite painful and expensive. So I just think closing the loop on this is desirable. I shared with you some of the things about the community health needs assessment. I'm glad the health department is doing things with STDs, and if I understood correctly, it's focused on health fairs. That's one very important step. I hope you do a lot more with radio PSAs and some of the other things. I think there's enough out there where people need reminders. The community health ranking data that suggested that Saline County's rate for chlamydia is above both the national average and the Kansas average is a recent change. It's like a 55% increase over 8 years. I think, I can't speak for the Robert Woods Johnson Foundation, but I think Community Health Rankings picks chlamydia because it's one that's most likely going to be ignored. And people don't see it as serious. But if I go back to my Google and internet checking, it does affect a woman's fertility. And we do know about women who really struggle a little bit later in life. And so it's important that all of this be addressed. And then I'm glad you spoke about the 4-county pilot. My understanding is it speaks to capabilities and capacities and assurances and insurances. I would just, as you rank the county, let's make sure that a copy of that is put before the commissioners in the reading room, because I think that is something you need to know about. If there's any deficiencies, just because we're a small group, we can't be everything to everybody. There's going to be some things that might not be well as strongly taken care of. I'd like you to be aware of that. Some specific things I would suggest is that if Dr. Dupuy is a paid health officer, that he and Mr. Tiller converse every so often about things like the increase in chlamydia rates, like capabilities and capacities, and ensuring and assuring different things. I'd suggest Mr. Tiller use someone else to take minutes, and I would suggest others mentor Tiller in roles in relating to the Health Advisory Council facilitator, whether that's done within the county or outside the health department, perhaps another agency. There's a certain skill in getting people talking and a skill in the art of follow-through, and I think that would be beneficial for the Health Advisory Council.
All right. Thank you for your comments. And any further comments from, I'll bring it back to the commission. Any further comments from the commission? Okay, Jason, thank you for your update. And we'll move on to item number 11.
Item 10, I believe, is
Excuse me,
where we're
10.
at.
I'm sorry.
RFA.
Didn't mean to skip over you, Hanny.
RFA 170-18, fiscal year 19 with CKF Memorandum of Agreement and KDOC fiscal year 19 Behavioral Health Budget Summary Revision with Annie Grievous, Community Corrections Director.
Good morning, Annie.
You've seen these grants, you approved them to be sent into the Department of Corrections, and this isn't unusual. They take a little cut, you ask for a certain amount of money, and you either get it or you don't typically.
Annie, I think that your thing is off again. The mic. The mic.
Well, how are you supposed to turn it back on? Guess I don't need one.
All right.
Maybe you can just hop over to the other chair, Annie. I know that
It's just for the TV. It's not for us. It's for the TV.
that microphone has had trouble, I know, for several times. We need to forward that to Mr. Grace, by the way, Andrew.
Is that one working, sir?
We'll have a momentary pause here to get their microphones working. Now they.
Did Jason do something else? Oh, okay. Oh, excuse me. That's okay. Oh, sorry.
Thank you.
Okay, now I know it's on.
Yeah, now we can hear you. Or I can hear you anyway, but public could.
Well, who couldn't? I mean, let's face it, you know who I am. Okay, so we requested the amount, $249,828.53, and they reduced us $10,000. The good thing is that I always call these kind of washes because we requested an amount. We never get what we requested, but they gave us $10,000 more than they gave us last year. So it's kind of a wash, but you still have to submit the budget, the revised budget. It's gone in front of the advisory board last week, and they approved and signed. And now the chairman of the county commission is requested to sign. Where we took the $10,000 in the behavioral health, it was out of sex offender treatments and groups, 6,500 there. and then out of alcohol and drug treatment and detox, 3,500 there. Because we got the more than we got last year, we're really in a pretty good spot with those kind of services. And those dollars play for clients to receive services at the mental health center or at CKF. A lot of our drug court clients can tap into this grant for the services if they're not under the Senate Bill 123. So it's a great grant. We apply for it every year and usually get a good amount. And we partner with CKF directly. And so in addition to signing the revised budget, we'd request that you sign the memorandum of agreement that we do every year with CKF. It always goes to Mike Montoya for approval. We haven't changed the agreement at all since we started doing this practice, but I already have Shane Hudson, the executive director from CKF's signature, so if I can get the chairperson's signature today, we are ready to go.
All right, questions? Bring it back to the commission for possible action then.
Mr. Chairman, I move we sign the FY 2019 revised behavioral health budget summary and memorandum of agreement requested by staff.
Second.
Been moved and seconded that we approve RFA 170-18 for the memorandum of agreement with KDHE, Behavioral Health Department, budget summary revision. We got one too many words in there, but we'll go with that. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Now we can move to item number 11.
RFA 171-18, fiscal year 19, KDOC Adult Services Budget Summary Revision with Annie Grievous, Community Corrections Director.
And you have the floor again, Mrs. Grievous.
Thanks. Again, it's a reduction. This is a slight reduction, $7,484.21. And that happened as a result of the DUI funds. We're given a certain amount of money from the state of Kansas for the DUI population we serve, and there was just less in that general budget for the DUI. And so they had to make reductions straight across the board for everyone, and so we took that 7,400 average. So if you look at the RFA, we just took it out in some ancillary areas where we could spare that. 500 out of fuel, 250 out of mental health evaluations, 250 out of treatment. Same thing with alcohol and drug evaluations, 1,000. Sex offender evaluations, 750. Maintenance, 2,200. Office supplies, 1,034.21, and then sex offender treatment, 1,500. We kind of have a reduction of the needs of the sex offenders at this time. A lot of the offenders we get are paying for their own services through their insurance or other means. And so we've had a lot of, we still have a good amount of sex offenders, but a lot more come in now with insurance and have the ability to pay for their own services. So we may pay for an evaluation to get them started, but they are able to cover the cost of treatment. And it's not inexpensive, so I'm grateful that those people have their insurance if they need to do that. So we're seeking approval. It's been in front of the board for the chairperson to sign off on the revised budget with a reduction of $7,484.21.
All right, questions? Sounds good to me. I wish we didn't need all this money for these programs, but that's the way of the world these days. So
you know, our population, if you look at the stats, are ever increasing, and so I'm grateful that those grants are out there, because I don't know what we'd do in this community if we didn't have those.
absolutely, I agree with you. All right, I'll bring it back to the commission for possible action then.
Mr. Chairman, I move we sign the revised FY 2019 Adult Services Budget Summary as requested by staff.
Second.
Been moved and seconded that we approve RFA 171-18 with the revised FY 2019 Adult Services Budget Summary. Are there further comments? Hearing none, I'll ask for all those in favor say aye.
Aye.
Aye. Opposed, same sign. Motion carries. We can move to item number 12.
Community Corrections Update with Annie Grievous, Community Corrections Director.
Great, thank you.
Morning again, Annie.
I attached the caseload report, so it's there for you to review. I'm not going to go over it. It just gives you an average population assigned each month and a released and those kind of things to just give you a picture of what's coming in and going out every month. And I think it's a full year if you got it. So then just an update on agency and the staff. You know, we relocated 309 South Broadway. The building space, interior finishes, expanded lobby space, expanded and increased security for client and staff is just super. If you haven't been over there, you should come over. I know many of you have. But the space and the safety that I think clients and staff feel from where we were is just phenomenal. And we're adjusting to it. So we're very, very happy. Anybody that would like to take a tour, we're happy to give them a tour. We've had people come in off the street and want a tour, and we're glad to do that. They can call the office, 826-6590, to arrange a visit. I couldn't be more proud of the location, the work done by the contractors. The landlord we're getting along very well with him. He's easy to work for, and he comes over and checks on us, which is very nice because I didn't have that. And the hard work the staff has put in. We moved ourselves. We didn't ask for any help. The staff did it, and we did it one of the hottest weeks of the year. They really, really worked hard, and I couldn't be prouder of them to get there. And I think that's part of the buy-in from them. I think they're excited to be in a new environment, and they certainly showed that. So. The costs have increased, and I'm sure you've heard it from me, and we are adjusting to the changes. We're still waiting for some pretty large expenditures to come in. Invoices don't come in as quick as we thought they might. So we're just really watching our monthly expenses right now, putting off overtime expenses and limiting some new things we wanted to purchase for the new building until we get everything paid off from the move and the work. But we feel like we're better on target the end of this month than we did last month. So we do feel good about it, and we know it'll just take a few months for us to get used to that new expenditure. And I'll tell you that Sherry Krause, who couldn't be here today, but she watches every little penny there is. And I tell you, she keeps me on track, so I appreciate the work she does. I said at the time when I wrote this, we didn't have a cleaning service, and we were cleaning the office and doing the trash, but I actually did hire someone yesterday, or a week ago, and he started yesterday. So we're excited to have him on board, and he did a great job. I kind of stuck around and followed him around yesterday, and we're grateful for that. So, and there's no changes in staff.
Annie, I'll take it that that's a part-time position, or is?
You know what? It's just a contractual position.
Okay.
We did a contract. I sent it to Mike Montoya. He approved it. It's just a day. They'll come in daily, not weekends, but daily, and do a thing. And then things increase. So I want the concrete done, but only once a month. You know, the concrete floors, because it's a specialized cleaning. So those kind of things. But we put it all in contract.
In a contractual
Yeah.
situation. Okay,
Right.
that's
Right.
good.
And under the DEOC, you've seen all the budgets, but we are flat funded, which to me is reduced, but we've completed everything. These last budgets that you approved today are taking care of it. The largest part supports the population of the staff and the clients. Any reduction is hurtful, but like I said, we're funneling those along okay. One of the things I always want to highlight is that we're the only agency, community corrections agency in the state of Kansas at this point, although I have sent our contracts out to other agencies. We contract with St. Francis and a few other agencies to collect their UAs on the clients they serve, and we receive income from that. And so at this point, we're the only community corrections in the state of Kansas that is making those kind of agreements and doing it to bring income into our building so we can service the clients and those things at a better rate. And so we're very blessed that the community asks us to do those works. And it does put more work on the staff. And so I always want to thank the staff for, a part of it, they just collect more UAs than we would normally. But I'm just so proud of everybody that steps up and knows that those dollars are important for the clients, and so they're invested in that. So they work a little harder, and that's great. But I've had two community corrections agencies contact me, and they're going to contact their St. Francis agencies in their area and see if they could maybe do something like that too. So otherwise, as I said at the board meeting, I think it's real important that people understand that community corrections doesn't get, with the exception of drug court, the county graciously funds a large portion of our drug court, but otherwise everything's grant funded or contractual work. We don't get, as a lot of agencies, court fees are provided for increases in salary and benefits to court service staff, or some things go to the county attorney based on court fees. There's nothing like that for community corrections. We solely stand alone and either come up with a contractual agreements to increase income, or we write the grants. And so that's why I'm always looking for new grants and new opportunities. And so community corrections across the state of Kansas is the only supervision program that doesn't get just straight dollars from somewhere. We have to write the grants, and if we don't get the grants or you don't write the grants, then your services and salary and benefits and everything are limited. So I just want to make that clear. I don't think everybody understands. They just assume we're a state agency or a county agency and somebody's giving us money, and that's just not how it is. So, and then I just wrote down the adult grant budget was $825, $157.99 for FY19. Then this is the juvenile one. I can tell you the same thing. We were flat funded, but we took no reductions. So the grant award was $738, $624.01. And the behavioral health, as you know, today was $239, $828.53. One of the things I do want to say is that our juvenile population is increasing, and not in a bad thing. That's a good thing, because we developed a program based on the new law, immediate intervention program, and it's a diversion program. We're seeing some real numbers come from that. And as a result of working in partnership with the county attorney, the police department, the sheriff's office, and coordinating with families so that youth are treated differently, they're not arrested, they're brought into our agency, and then we have about 4 to 6 months to provide services for them and get them back on track, and then they never enter the justice system. So it's a great project, it's a great program, but if you didn't have the collaboration like we do in our district, I could see it difficult to get it started. So I want to always acknowledge those partners in our community. And then grants, at this point, everything we've applied for, we've got, with a little bit of reduction. I'm applying for a federal grant, the Justice Assistance Grant. Right now, it's not open because of the sanction cities. It's kind of a funny thing. Some federal funds are released, but this one was not from the federal level, so I just check on a regular basis. They're supposed to notify us. I was looking at a MacArthur Foundation and the Arnold Foundation, and there are some funds that we might apply for a crisis center, but also I was thinking of the jail, so I'm continuing to do some research. Jim Robertson and I tapped into a couple of places, and I told him I'd do some researches on some of those foundations. So as I continue to look into that, it looks like there might be some free technical assistance and maybe some dollars we could apply for our jail work, and we could attach it to maybe some crisis work too with the mentally ill clients and servicing them. And then I'm still going to go after the city alcohol tax. It runs on a different cycle than the county one, so I'm waiting for it to open. I think it might be in October, so I've never applied for those dollars, but 85% of our population live in the city of Salina, so we should definitely tap into some of those dollars for services. So that's another thing. Advisory board continues to meet. They do everything they've been doing. We had a good board meeting the other day. The PD contracted and hired a crime analysis position, Bernadette Stewart, and she came and presented a little bit to us. And I'm excited because there's a lot of things she's going to be able to help the entire justice system. She's going to be able to go in and plot out certain areas where the highest maybe sex offenses are, or where our highest, most violent offenses are in the city, and those kind of things. And it'll help our surveillance when we're out kind of randomly doing things in the city and looking for our own population. So I'm excited to get working with her. And then drug court, it continues to do well. It's been in existence since 2013. Currently, there's 84 graduates, a 94 success rate with UA testing negative, a retention rate of 88%, and keeping all clients within the program and active. And we've had an amazingly low rate of only 7% have reoffended. So when you think about the total number of graduates and over that long time period, only 7% reoffending, that's excellent. So we're doing well. I think that drug court will continue to see successes because of the staff and the collaboration in the community going on there. And that is my update.
Thank you for the update. Well written and to the point, and we appreciate that very much. I want to ask you, Do you know how many other counties or areas, or how many community corrections there are other in the state?
31 districts.
31 districts.
There's a couple that every district has to have access to community corrections. So there are a couple that have maybe joined together, but not very many anymore. But there are a couple like that. But every district by statute has to have access to community corrections.
Okay, I want to announce that I did do the GINA training yesterday at the jail. Interviewed a couple of female inmates in that jail reduction movement thing that we're trying to accomplish. Could you give us a quick update on Mr. Robertson, or where that's headed?
I can. I've asked him to provide a summary for everybody because we did get to spend some time with him a week ago or 2 weeks. I can't remember exactly when he was here, and I got to spend some time, and I think he went over to the jail and he spoke with Rita. But what's going on right now is continued data collection. One of the things he said, the GINA is really giving him some good data, so I'm grateful for everybody that volunteers and goes over to the jail and does that. It's very helpful. We're looking at the Arnold Foundation, which I mentioned earlier. They have it's a PSA, but I don't remember what their words stand for. But basically, it's a pretrial assessment. It determines risk, the risk of the client being released from jail and the possibility of the risk of them not returning to court. And it's just like the other things we've looked at, but what we like about it, Jim and I, is that we can get it for free and we can get free technical assistance with it. So that might be a good way to go, and that's why I went on their website and registered, and I'm receiving all the information now. So we're doing that. So Jim is still in the data collection phase, but what he also did was he met with all 3 district judges for a short time, one of the days, and then he also met with our county attorney, Ellen Mitchell. And he is supposed to prepare a summary of those conversations for the commission, so you're aware of those conversations. I spoke with Judge Johnson after the meeting. He said it went very well. They stressed the fact that they really want pretrial, but they've been asking that for a while. Judge Johnson and the other judges, only pretrial they've seen really and like is that Johnson County pretrial, and it's an excellent program. But I think that we can do our own thing and remember about Johnson County, but also look at this opportunity through the Arnold Foundation. So they said that was the first time we really met him, liked him, thought he was very good, had good data. And look forward to the next visit with him. And I don't know how the visit with Ellen went. I'm not sure, because he left town just as soon as that was over. I don't know if Rita knows anything more than that. But he is supposed to provide us with a summary, so hopefully that's coming. And the data's just going to keep coming in from the jail. And I think we're finishing July. We planned, I think, for August. So I didn't plan, I don't think, beyond August, because we kind of thought we might have enough by then. And that would be my hope, that we would have enough. So what I think we'll focus on now is this other assessment. And Jim is coming back the end of August. But I asked if he was going to meet with a full group or just, again, a few of us. And he said it's too early to know. He wants to see what the data looks like mid-August. So I'll try to keep you updated, or Rita certainly will keep you updated.
Okay. Back on the GINA, do you know how many people have been interviewed to this point?
I do not. I can find out. I will tell you, every female that lasted more than 24 hours there has been assessed, but I do not know how many total numbers have been assessed.
I know that in the list of people that I was provided yesterday to call in for interviewing, because it's a random thing.
Right.
I mean, I went through about 10 of them that weren't even there anymore, so they've already been released.
Right. If we didn't capture them because they got gone before we got there, even though we're covering 4 days a week, it's going to happen. They were just released sooner. So that does happen. You'll see a list of the females, and they're already gone. I was glad you got 2 in. The data, that won't skew the data anywhere. We're just curious about the offender population there long term and why they're in long term. So that GINA assessment gives us a really good picture of those ones that stay longer.
Well, I certainly am not an authority on that, but out of the ones that I've done, the questions and the answers, they pretty well line up together. And so, I think that somebody who really is on top of this, like Mr. Robertson and yourself, they're going to be able to collect there's a real trail there.
Yeah.
And
he's liking the data, he said, and also that other mental health one or behavioral health one that they're doing for both populations. He's getting that. Lauren at IT is, gathering it all and sending it in a form that Jim can review. And Jim's partner, who understands pretrial, is also looking at that stuff. So you're right. I think the GINA information, because it's a little bit more of an expansive assessment, and it gives the women the opportunity to kind of think through some processes, I think we're learning a lot more than we realized.
And I want to say that I run into people nearly every week that are asking, why are we spending this money on these studies at the jail and so forth? And I want to remind people that I think it was this morning that I saw that we still have 289 people incarcerated in jail, which we have basically space for about 175. So that means we have over 100 people out of county, housed out of county at a cost of $35 a day, not counting transportation costs and things like that. So it's a significant amount of our budget that we are. This is not very much money to spend on something that's so significant.
Right, and I think it's critical that you say, people ask you that look at the population, they're all volunteering. Nobody's being paid to go over and assess. Nobody. You're not paid. I'm not paid. My staff aren't paid. Rita's not paid. We're not paid to go over and do it, so we're volunteering that time. So it's a very, very small cost of all the data we're getting. It's costing the county very little. It costs the $6,000 of the training, and that's all it's costing, except for whatever, I don't know if it costs anything to send the data up. But so and the reason we're doing that, and I'll say it over and over, is until you know who's in your jail and what population's there and what the critical needs are, I don't think you can determine what kind of bed space you need or what level of bed space you need until we know.
And that was another comment that I've heard this week, that we're looking at building a new jail, and that is nobody has said that yet, not even close.
Nope.
So we're looking at ways to reduce the jail population. That is our focus.
Correct.
So again, thank you for your comments. And any other comments or questions from the commission?
Just going to your meeting last week, I tell you, I just was totally still impressed of in such a quick time frame that it got in there, got all set up, and looking like it's been there forever. I mean, but what a beautiful situation and a safe area for everyone to work in, and it's quite an improvement.
Thank you. We feel the same.
Yeah.
Very blessed.
Yes.
All right, thank you, Annie. Under announcements or other business, I wish to remind everybody that the county clerk's office is now open for advance voting. It's a quick, easy way to make sure that that you get time to vote instead of waiting till the last minute when you may or may not be in town or have something busy to do. They're open from now until like the day before or the day before of the primary.
More voting from Monday through Friday from 8 to 5. And then that will go until the August 3rd. And then August 4th is a Saturday. We're voting from 10 to 2 in our office. And then Monday, August 6th, we will vote from 8 to noon.
Okay, and there are volunteers there to assist you if you need the help. It's a quick, easy way to vote. Park right out front and be done in a couple of minutes, really. So I also want to put in a quick punchline for something that's near and dear to my heart, and that's the upcoming lead sled thing that's going to start happening. You'll start seeing those cars around town probably as early as tomorrow. 2,200 cars. I don't even know what the number is of people that attend the show, but it's really a neat event for Saline. So even if you don't like old hot rods like I do, you could come out and see something that's pretty interesting, to watch the parade or the drags or all the people that are around town that come to town with what it takes to bring 2,200 cars to town. So we thank everybody that volunteers and helps with that. So are there any other announcements? Okay, I'll take a motion for adjournment.
So moved.
Second.
Been moved and seconded that we adjourn. All those in favor say aye.
Aye.
Aye. Opposed, same sign. Motion carries. We will take a short pause and have meeting number 2 in the adjoining meeting room.